anyone done any fun outdoor activities they want to highlight, bring up to the group? None? Hi, Diane.
Not really too exciting, but the weather for mountain biking around here has been very good. So just been getting out for that, which is good.
Mhm.
Trails are in good shape. Yeah.
Yeah, not too wet.
Yeah. Yeah. Yeah, we don't really have like a mud season. I know the Northeast has a mud season. We don't
Yeah,
really have that down here in the Southeast too much. Yep.
sounds fun. I'm always a little scared whenever I go mountain biking, though. I'm not quite as good. I think I just don't have the right gear for it. I have like a hybrid bike that's not strictly mountain biking, so don't have the suspension or um, shock absorption that I think I need.
Yeah, that makes a world of difference. Yeah, like mountain bikes within the past 5 years have changed so much that yeah, it's night and day.
Yeah, absolutely. All right. So it's a few minutes past. We will get started. I want to welcome everyone to the Parks and Green Space work group. We are led by our work group co-chairs, Dr. Rich Christiana, who just spoke about his mountain biking adventures, Dr. Jeanette Gastat, and Dr. Sandy Slater. My name's Emily Kaufman. I'm a recent graduate of George Washington University. I got my Master's of Public Health. I am the one that's coordinating all of these meetings. Today we have a very, very special guest. So we can get right into it. So we are going to do the introduction, then get to the presentation with Gretchen Patch, then a Q&A, then we'll talk about the next presentation, any upcoming meetings, and then, like we always do, open mic feedback. So I will introduce our guest today, Gretchen Patch. She is the Senior Director of Strategic Health Initiatives for the American College of Sports Medicine. She oversees the American Fitness Index, which she'll talk about that today, and administers research grants and travel awards and manages a team focused on scientific programs and initiatives. Prior to joining ACSM, Gretchen worked for the Alliance for a Healthier Generation in program evaluation to assess the impact of continuous improvement program that helps students implement healthy policies and practices. A lifelong Jayhawk, Gretchen earned a bachelor's in athletic training and a master's of public health from the University of Kansas. And with that, I will stop sharing, and Gretchen, I will let you take it from here.
Thank you, Emily. I will share my screen. Okay, well, that loads. Let me check. Yeah, okay. Well, good morning,
We can
everyone.
see your
Thank you
screen.
so much for having me and allowing me to share about ACSM's American Fitness Index. Before I get started, a brief disclosure. The work is funded in part by the Elevance Health Foundation, but just like many of your research grants, the sponsor doesn't influence the development of the rankings, the selection of indicators, or anything connected to the methodology. They do assist us in the dissemination process and they contribute to the cover letter in our report, but that's really where their impact stops on our work. So just wanted to get that out of the way. I'll dig in with the fitness index. For those of you who are not familiar with the American College of Sports Medicine, it's a membership association with a mission to educate and empower professionals to advance the science and practice of health and human performance. Our members include researchers, clinicians, and practitioners in exercise science, sports medicine, kinesiology, public health, among many, many other specialties and professions. I'm not sure of if anyone on this call is a member of ACSM, but if you're not, I would encourage you to check out what we have to offer. I see Brett's thumbs up. The fitness index. So who's on the fitness index team? It's our ACSM staff. We have an advisory board that's comprised of ACSM member experts, and then we have consultants from Coughing and Associates that help us with data analysis. So that's kind of who works on the fitness index. I lead the team effort. I'm kind of a Jill of all trades, as Emily kind of shared in the intro. So the fitness index is one of the projects that I work on, and the one that really brought me to ACSM. So really excited to share more. So what is it? So if you're not familiar with the fitness index itself, the fitness index ranks the 100 largest US cities on their community fitness, a concept that we consider analogous to individuals having strong personal fitness. Cities that rank near the top of the fitness index have more strengths, resources that really support healthy living, and fewer challenges that hinder it. Giving you a quick look at the 2023 top 10 list. You can see Arlington and Washington, D.C. are number 1 and 2. This is a 2023 list because we don't release the new rankings for 24 until July. So look for those in a couple of months if you're interested. So why do we do these rankings? Well, the goals of the fitness index are very similar to some of the organizations present on this call: improving health through increasing population level physical activity. As you all know, healthy, active cities don't occur in a vacuum, and a culture of health is created when urban planning, local policies and funding, and health promotion behaviors intersect. So the fitness index uses the rankings to encourage city leaders to enact policies and make systems changes to promote healthy, active lifestyles. With that said, our primary audiences are city officials, community-based organizations, and others that can use the information in the rankings to advocate for those healthy changes locally. So what indicators are included? The fitness index uses 34 indicators that are weighted, and we'll talk more about that in just a minute, covering personal health behaviors, health outcomes, built environment factors, recreation facilities, local policies, and funding. Before a new indicator is added to the fitness index, it must meet the criteria on the slide and be available for all or most of the cities in the sample. Now, we do have some of our data sets that we use that don't include all 100 of the largest cities, so we have to collect some data manually, but by and large, we try to find it from publicly available data sets. I don't know if that graphic is large enough for you all to kind of see how they the groups of indicators that then flow into the subscores for the total score, but we'll talk more about the subscores in just a second. As the Green Spaces group, I pulled a list of our community environment and indicators so you can kind of see what we're working with in that space. You can also find these on the website if you'd like to look through the data a bit more, and I'll share that website on the last slide. But what you can see here is, we have everything from walkability, bikeability, to parks and park proximity, which is percent of residents that are located within a 10-minute walk of a park, complete streets policies, park funding, and then we have a host of recreation assets as well, from ball diamonds, basketball courts, playgrounds, and so on. So looking at how the rankings are calculated, as I mentioned before, our sample size is the 100 largest cities by population, and that changes very slightly year to year. So we have 1 or 2 cities that at the bottom will change from year to year, just because natural population changes. But by and large, we have about 98 to 99 cities that are pretty constant on the list. We use several different data sources in the fitness index. The most frequently used one is the BRFSS and the Trust for Public Land data. Again, we try to use data sets that are publicly available so that we're not, pulling from sources that city officials can't then source themselves or kind of validate, something like that. As I mentioned, indicators are weighted individually from 1 to 3, with 3 being indicators that are of the highest importance for community fitness. We then take the weighted average of the 2 subscores and then form a total score, which is then ranked so that cities can compare how they're doing. If you really want to get into the weeds of the methodology, we did publish the methodology last year in ACSM's translational journal, and I can add a link to that article in the chat at the end if you're really interested in that. It also talks about, excuse me, it also talks about the background of the fitness index a little bit, and how it came to be, and what the kind of data landscape was at that time. So the fitness index, we're entering our 17th year of doing these annual rankings, and when the fitness index really started, there wasn't anything comparable at the city, county, local level at that time. So we were kind of early in the game. Now, since then, there's the county health rankings, the America's health rankings. I always get that one wrong. There are a couple of other folks doing similar work. So we're not the only folks in the game anymore, which is fine, but we still think there's value in looking at the data in this way. So how do we share the results once we do the analysis? We really share them through multiple channels and a year-round dissemination plan. And this is really one of the things that we kind of excel at. The bulk of the data are shared through an online comparison tool, which allows the user to select up to 3 cities so they can compare and contrast their city with similar size cities or geographically located cities. We can also compare to the top ranked city for each indicator, depending on what they're interested in looking at. We also develop a summary report with highlights and insights into the data, as well as messaging that targets city officials. After the rankings release, our focus really turns to content that includes infographics, social media, blogs, and resources, all of which focus on data insights and then calls to action, ways that the end user can take this data and do something with it. How do we measure success? So as you all know, outcomes measures take time. So like any other communications and advocacy initiative, many of our evaluation measures are in fact process measures. We track we track traditional media stories, including print and broadcast. Of course, we track social media engagement and reach, newsletter open rates and click-through rates, things like that. We also track touch points and outcomes with elected officials. So we're trying to expand our efforts in grassroots advocacy, particularly looking at our ACSM membership, activating and engaging them in those same strategies. Just taking a minute to develop that a little further. One of the things that's really important to us is that ACSM as an organization is not going into these cities and saying, here's what you're doing wrong, here's how to fix it. But instead, what we're doing is we want to empower ACSM membership to take this data into their community as local experts, excuse me, and say, here is some data about our city that as both a local expert and a resident, they can advocate for their city for things that are important locally, not ACSM coming in and saying, here's what to do, and kind of bossing people around. We really want it to feel and to be more at that grassroots level. Dissemination of the fitness index has been and continues to be very successful. These efforts raised out of raising awareness of what cities are doing well and where they have room to improve. The fitness index has been included in several high-profile, nationally recognized publications that fuel our exposure. In 2023, the fitness index was included in more than 500 print and broadcast stories, including an exclusive story in the USA Today. Between traditional and social media, the fitness index had a potential reach last year of nearly 1 billion people. And so that's across all media opportunities. So it was our largest year to date. The outlets on the slides are just a sample of media outlets that have covered us in the past. These aren't all just last year. These are kind of across the years, but just a sample of those. So what's next for the fitness index? As I mentioned, we're focusing on our grassroots, excuse me, on our grassroots advocacy strategies. Like I said, ACSM has members in all 100 cities, and we're working to activate them as those trusted local experts. We're also building relationships with partner organizations to develop resources and digital content that will help us get the message out, especially to those elected officials and community-based organizations that can really pick it up and take it from there. And with that, I'll open it to questions. I do have my contact information and our website on the screen if you're interested in more. And I can drop the link to the methodology paper in the chat if folks are interested in that as well. Emily, I feel like I was a little quick there, so plenty of time for questions if folks have questions.
Absolutely. I was also wondering if you have it available to you, if you could walk us through the website and kind of walk us through that comparison tool, just so that we can see it all together. I mean, we can all explore it on our own, but if there's any sort of like specifics that you want to point out to us, or like sort of like the inside scoop of where we should go to find the data that we need.
Yeah, let me switch screens real quick and I will get that for you.
And then you can put your questions in the chat, or when we get to questions, feel free to unmute yourself.
Let's do this. Okay. So this should be sharing in a second. The fitness index homepage. I'm going to move you all off to the side. Okay. Okay, so this is our general homepage. To get to the comparison tool, there are a bunch of ways. At the top, it's the easiest to just click rankings. Once you land here, you can of course download the 2023 report, which lives here and in a bunch of other places. But as you scroll down, you can compare cities by selecting. So I live in Indianapolis, that's where ACSM is based. So I'll select Indianapolis, they're alphabetical. Any other, I can show you, I'll just pick Chicago since it's close. And I'll pick Kansas City because that's where I'm from. Still Kansas City at heart. So we can kind of compare and contrast. Chicago's maybe not a fair comparison given the population difference. But we can see Indianapolis and Kansas City don't they rank toward the bottom of the rankings, where Chicago, Illinois is in our top 20, doing pretty good overall. As we scroll down, you can see the subscores, the personal health subscores and indicators personal health rank and subscores. And then each of the individual indicators along the left. You know, everybody has a little work to do on physical activity. That's kind of a consistent across the board. And then we'll scroll down. Some of our health outcomes are listed here. And then we get into the community and environment subscores with the built environment, recreation facilities, and policy and funding. So that's, you know, kind of how to use the comparison tool, looking at what's important in any particular city. For example, all three of these cities have some kind of local complete streets policy or ordinance, but if you had a city that didn't, which I'm gonna bet, yep, Arlington, Texas does not, so they score a 0 on that indicator because they have no policy, ordinance or executive order or anything in that space. One indicator that I really look at a lot is park expenditures. And it's because I look at that because I'm a big parks person. I saw we have some folks from the National Parks Department, which big fan of your work. But Indianapolis, we spend $47 per resident on parks. And, you know, we have cities that are spending, I believe it is San Francisco, I might be wrong on this, that is our number one, or yeah, our number one city here is San Francisco at $377 per person on parks. The average across all 100 cities being $120. So Indianapolis has a very long way to go to even be average in park expenditure. So that's one I always kind of take a second look at. Any questions there? I'm not sure I can see the chat. Let's see.
There was one question. What does a score of 2 mean for the complete streets policy?
Yeah, that's a good question. So a score, I'll kind of walk through the range. So a 0 means the city has no policy, no ordinance, no executive order. They have nothing in place. They have no statement on a complete streets policy. A score of 1, and I can't think of a city that has a 1 off the top of my head, but a score of 1 means they have something in place, but it has no teeth to it. So there's no, it's maybe more of an executive order, or it's a policy, or it's like a design plan, but it's not really an official legally binding obligation. And then at a 2, it has teeth. There's something legally binding to it. Yeah, it looks like Denver has a score of 1. Thanks, Rich. Yeah. So there are a couple of cities that have, you know, they're taking steps in the right direction. They just are not legally binding. They're softer obligations.
Yeah. Well, I can definitely see this policy and funding section being of use for advocacy, and to even compare to neighboring cities or cities that are in the same sort of region, say, hey, we're not measuring up. Indianapolis is not at the same level as Texas, Arlington, Texas, or something like that.
Yeah, and it's one of the things too there are limitations to the fitness index. We will own that, right? So the park expenditures doesn't account for any federal spending. So for areas that have a lot of national parks, or cities that are close to areas that have a lot of national parks. It doesn't take into account any of that. Our park proximity measure doesn't take into account if your city is located near, I don't know, let's say Rocky Mountain National Park, right? Like it doesn't take that into consideration. So there are some limitations in that space. We also have some limitations in the indicators that we list because we don't have the data sets to include them. So for example, for years, we have wanted to do either miles of bike lanes or miles of trails within a city. We think those would be excellent indicators to add, but we can't find a data set that includes most of our cities. And we don't have the capacity to source that data every year for all 100 cities. So we're a little bit limited in that space. I'm just gonna stop sharing so I could see some of the other questions.
I know, Gretchen, you had mentioned that. So if anyone on this call is aware of any publicly available data sources that cover all 100 major cities that speak to trails or sort of those sorts of systems, please let us know.
Yeah. Or if there are other indicators that that you know there are good data sets for. Like I said, it doesn't have to include all 100 cities, but we do need, you know, a majority of them. And that's a challenge, right? Is having that data either at the city or the county level. That's been one of our limitations in expanding data sets. And I see Sandy's question asking if we're looking at adding additional measures. We're very open to it, but it's just a matter of having data in the right places.
Yeah, I was really interested. So you've got a lot on the environment, like the policy environment, the built environment, and I was wondering about adding like social environment questions. I mean, because there's things like social vulnerability index, which would be available, and it's, you know, I think it would be pretty easy to even find it probably already constructed either through the census or CDC or something.
Yeah.
And I was just wondering how that might change some of the scores of these cities. Another one I was thinking about just in terms of social environment, which would have a significant impact on, or it could have a significant impact on fitness and physical activity, would be crime rates, which would also be available through the Uniform Crime Reports or something like that.
So both very good suggestions, Sandy, and your head is actually in the same space as our head.
Okay. Okay,
So
good.
if you're an ACSM member and you're interested in the fitness index, social vulnerability index, that's actually something we talked about for the first time this fall, potentially adding for 2024. Unfortunately, we weren't able to get that data in time to do the analysis, believe it or not. Starting the data analysis actually starts in October before we release in July. So it was a timing issue this year, but that is something that the advisory board talked about this last year. And then for the crime data, you know, years ago, we used to include it as part of the demographics. So it wasn't considered part of the indicators that we ranked and weighted, but it was reported as part of the demographics for each city. So you could take that into account. We kind of pulled back from that a little bit when we moved from, and we used to rank the metropolitan statistic areas. And that's when we were reporting crime data. We pulled back from crime data a little bit when we moved to individual cities and reporting demographics for individual cities. It just looks a little different at that level, and we hadn't gone back to it yet. But yeah, you're spot on.
Yeah, I see that Emily also said other environmental justice related indicators, and Jeanette said average heat index. I mean,
Yeah,
I was thinking a lot. I know a lot about Madison in particular, and it ranks very high. And a lot of the cities that rank very high have like would also probably rank extremely high as having significant structural racism within them, which would lead to a lot of health disparities, particularly when you're talking about fitness of the populations, the diverse populations that are in some of these cities. So, I don't think there's any like constructing something on structural racism would have to start from the ground up, but I was thinking of other things that might be good proxies for it.
Yeah, that's a really good point, and it actually does call to mind one of the other limitations of the fitness index is that we don't have data at the neighborhood level, right? So we can't piece out within any one particular city where where they're missing XYZ or where they're, they could use some more supports on a particular indicator. There are, parts of the Trust for Public Lands, and I think maybe, not sure what this, yep, Diana mentioned TPL. Parts of their data sets that are not included in our fitness index, they do have maps that show where parks are most needed, right? Where cities could really use new parks or additional facilities, things like that. So there are maps that show, we also have food access or lack of food access. And there are different maps that can kind of show that. We just don't have that as part of our mapping in our data set. Let me see.
Yeah, I see Diana has two questions. One earlier, do you provide summary data to help spot/track trends in the data? Is that available on the website?
We do, so in our summary report, we kind of find a theme every year and we share trends in the data. So last year in 2023, we really focused on chronic disease measures in the report. In the year before that, I think we looked at mental health and physical activity. That's a really powerful connection that people a lot of times don't make that connection. In past, we've looked at active transportation and physical activity in the built environment, those kinds of things. So usually in our summary reports is where you'll find most of that kind of trend data. Trying to see, I feel like I'm missing people's questions, so I apologize. I'm not skipping questions, I promise. I just limitations. Okay, I'll have to get back to you on which Trust for Public Lands park score data that we're using, because we don't pull just park score, we pull from some of their from some other data, I believe. So I'll have to get back to you on that. But I do appreciate the note on it, including national parks in their data. So I'll have to follow up on that a little bit more. And Jeanette's question, does parks per 10,000 include or exclude national parks? I believe it only includes local community parks. I believe it does not include national parks. Other questions, anything I can answer? I do see we have Melissa Rohde on the call. Hi, Melissa. Melissa sits on our Fitness Index Advisory Board. So if there's anything that you guys, if there are other questions that you have after this presentation, Melissa can, you can either reach out to me, but you can also reach out to Melissa on that.
I have a question. So you said that there are other organizations that are doing a similar thing. Are the results similar? Like, are you finding that the same cities are sort of making the top of the list and the same cities are making the bottom of the list? I guess are
Yeah, it's a
the
good
outcomes
question.
the same?
Um, I think that we're just different enough that the outcomes look a little bit different, right? So, and other organizations that are kind of using similar data sets, similar indicators, aren't as focused on rankings as we are, which maybe that's something for us to think about and look at is, you know, being in sports medicine, we've got competitive folks, but we're not seeing exactly the same outcomes because we're not measuring exactly the same thing, I guess is the short version of that. We have had some folks in the past ask if we have, I guess, adverse childhood events. They've recommended adding adverse childhood events as an indicator. That's something that we've talked about a lot in the past too. Again, it's tricky because of data sets that cover at the city or county level for all 100 cities. So that's something that we're interested in as well. I see
Yeah,
Brett's
Edie put
comment.
in,
Oh, so go ahead.
oh, sorry, Edie just left a comment. I wanted to add that racial covenants can be an indicator of structural/environmental racism. Some cities have been mapping historical trends of racial covenanting of property deeds and this relationship to environmental assets.
That is a really good, that's a really good lead. I can take that, sorry. I'm literally gonna make a note because if there's not a note made, then there's no.
Edie, do you want to unmute yourself and tell us a little bit more about this indicator? This is the first I'm hearing of it.
Yeah, absolutely. So actually, I'm from the Minneapolis-St. Paul area of Minnesota, and Minneapolis has, I think it's a leader in this regard. There is a group of scholars who's leading a project called Mapping Prejudice, and they have been working with a group of phenomenal volunteers because it's quite an effort to undergo looking at property deeds and understanding which deeds have racial covenants attached to them. So if you haven't heard of this term before, essentially, it was writing into the property deed that individuals who were coded as non-white, and this could be based on race, ethnicity, or actually religion as well, were not historically allowed to purchase that home. And racial covenants were actually legally, they were legal to use in the United States of America up until 1968. So they're not really an artifact of the far past. They were used until quite recently. And of course, as we know, generational housing issues, if you're somebody who lives in a house that was racially covenanted in more of an environmentally, I would say, privileged neighborhood. So these houses tended to be in neighborhoods where there was lush areas like pools, parks, things of that nature. Persons who generationally were given these houses essentially from their ancestors, they still retain these houses today, right? So it can be actually a marker of structural racism that's a little bit more salient even than redlining, which is a really interesting facet to understand. And I think Madison, Wisconsin as well is doing a racial covenant mapping project out of University of Wisconsin, but I can throw the mapping prejudice link into the chat here. It's just a really worthwhile effort to map and understand some of these structural racism issues that we grapple with today, still in our cities. And I think it would be a really wonderful and worthwhile effort to hopefully add this to the index.
I would love that. I think that would be really helpful for us to kind of start looking at and talking about. Actually, now is a good time of year. Like I said, we really start conversations in October for the following year. So now is a good time for us to start looking at things and planning for 25. It's weird to say that. I did take down some of the other notes I saw in the comments about average heat index. I think that's a really good one as well. And then Edie, as you were talking, it made me also kind of think about maybe tree canopy coverage, right? So you had mentioned lush green spaces, and I know there are folks that are looking at tree canopies in different communities and how that impacts that kind of connects with heat index and things like that. I see Janet on the call too. Hey, Janet, she's also on our advisory board. Janet or Melissa, anything else that I'm missing or that you think I should share with the group? Not to put you two on the spot, and please don't feel pressured.
I don't have anything right now. I did write down some notes about the racial covenants. So
Yeah.
yeah, we could have a good discussion about that once we all gather next. So thank you guys for that.
Yeah, I had a student in my office, so I joined late, so I'll have to catch the recording of the first part.
Gotcha.
But I think you covered
I did-
everything well. So thank you.
I did have one more question. And while we're just kind of throwing out ideas or brainstorming, I wonder if there's any thought as to creating this sort of index for rural counties. So, because I know that there's a challenge of physical activity there as well, but it's maybe a slightly different set of challenges. So
Yeah.
I'm curious if your group has put any thought to that.
Yeah, that's actually one of our also one of our frequently asked questions. We have talked about it, but one of the challenges that we face with adding new indicators for the fitness index is the same for rural communities, is having data at that local level. Unfortunately, it's just once you get to small enough communities, it's really hard to find the right data. So what we've done, not just for rural communities, and I'm a rural Kansas girl, so believe me, I would be all for expanding to rural communities. But one of the things that we have done for rural communities or mid-sized cities that just didn't make the population cutoff to be in the fitness index is we created a community assessment tool that kind of walks folks through doing an assessment in their own community to see. It doesn't create a ranking per se, but it gives them an idea of how they compare to similar communities, and they self-select what the community that they would compare themselves to, or if they're comparing to other counties, things like that. It walks them through the process of doing that community assessment to take similar next steps.
Great, thank you.
And I did drop the link to the methodology paper in the chat for anyone that's wants to get a little deeper into the process. It's been kind of a journey. Like I said, the fitness index has been around for 17 years. So there have been, we've made some changes over time, both in indicators and then in the population that we're looking at. It used to be just 50 MSAs, and then it expanded to 100 cities. And we were really kind of look at the indicators every year and see, like, is this one still appropriate? Is it, do we still have data sets that are updated frequently? So a couple of years ago, maybe 4 years ago, we took sleep off of the fitness index. Might have been longer than 4 years ago. Time is a rough construct lately. But we took sleep as an indicator off of the fitness index because the data weren't being collected on a regular basis, and then they were. And so we added sleep back a year or two ago. So just kind of really looking at what's available and going from there, trying to be responsive to the data that are available and what's important and things like that.
Any other questions? I did see one came in from Kimberly. Have there been any brief tools for individuals and communities to explore their access?
The one tool we do have is that community fitness assessment tool. And that's really meant for cities of all sizes that are outside of the largest 100.
Yeah, if it's the one that I'm thinking of, it's like a comprehensive methodology to go in and look. And, we're kind of struggling with like people that are at the park, how do we assess, if they're just coming through, and not necessarily they could be coming from anywhere. Is there any kind of tools that we can use to kind of look at their satisfaction or, how easy it was for them to get there? It's kind of a different focus maybe.
Yeah, I know those exist, and I'm thinking I have their acronyms in my head, and I'm not it's not the So Fit and So Play, it is they're not tools that we've created, but I know that there are tools that others have used, and when I think of them, I can certainly I apologize, Kimberly. It's I'm drawing a blank at the moment, but I can shoot those over to Emily to share with the group.
Thank you. Sorry about that.
Nope, that's okay. It's just drawing a blank at the moment. And for anyone that is an ACSM member attending ACSM's annual meeting, you don't have to be a member to attend the meeting. Please come to the meeting if you like. I'll be at the attendee services desk quite a bit, so feel free to stop by and say hi. And if you have more questions, you can see me there. And I shared my contact information with Emily, so feel free to reach out. We do share our data with researchers. Just sign a quick data use agreement, and if you're ever interested in taking our data sets and doing anything with them, so you're welcome to think about that. We've had some graduate students that have used it for dissertations and things like that. So I will put that out to the group if you're interested.
Wonderful. Yeah, we will definitely brainstorm and see maybe how we could best use this data. But we appreciate you spending the time talking with us today. It was really informative. And I'm excited to look through the methodology a little bit more.
Great. Thank you for having me. I'll let you get back to the rest of your meeting.
Great. Thank you, Gretchen.
Thank you.
Thank you so much. This was great.
So with that, our next meeting is going to be on May 27th, so a month from today. Our speaker is to be determined. I had a speaker lined up, and she's going to actually present in June. So if anyone has any ideas for a presentation, please don't hesitate to reach out to me.
Emily.
That's Memorial
Yeah, I was
Day.
gonna say, that's Memorial Day.
Oh, silly me. That's probably why.
Yeah.
Probably why. So let's think about it. So maybe we move up a week. And then maybe I will actually get a speaker who's willing to work on Memorial Day. So the week before that would be the 20th. So if that works for everyone, we will move our next meeting to May 20th, the week before Memorial Day. And then with the time that we have left, if anyone wants to open it up for any announcements, shout outs, things that we need to know as a group, we have a few minutes. Nothing? I'm sure you're all winding down the school year.
But maybe a quick plug for save the date for the 2025 conference. I don't know if anybody's seen that, but March 17th to 20th in Manhattan, in Kansas.
Yes, for the Active Living Conference. Hello, am I frozen?
No, we heard
I'm
you.
sorry, can you hear me?
No, I thought I was frozen for a second.
Oh,
In Manhattan campus, as Rich said, living conference.
Sorry, I think my internet's breaking up. Yes, and it was wonderful. I got the luxury of attending this year, and it was so wonderful to be around other like-minded individuals. So excited for next year.
And to
Yes.
meet, so we actually.
Have any other announcements, but one talked about was possibly using this data, right, Rich? We were talking about possibly using this data for at least to generate some ideas for additional projects or analyses. So maybe, you know, those of you who are on the call think interested in answering, we can and you can send those proposals to us and we can try and move those forward and some few to better explore this data.
Well, that's really interesting.
connection with Gretchen and ACSM came from was out of the idea of, you know, kind of exploring if there are any connections with what we're doing here to what they're doing with their data sets and the data sets that they're pulling in, and seeing if there's any way we can connect, because it's particularly around that environment section is really just kind of in our thing with them. Also, I was thinking park and lieu fees and density bonuses policies, connection with some of these data sets as well, possibly. But yeah.
So we have work over the summers.
Yeah, we can carve out some time on our May call after we finish with a presenter, and we can just touch base on projects that we might want to try and move forward
Yeah,
as
so
much as
maybe
possible during the summer.
that's great. So maybe Emily, when you send out, because I know only a few of the people on the listserv are here, if like people could submit like research questions or just very general. It doesn't have to be formal, just like, what do you want to look at? What could we do as a group? Because we've got this group of great people with all these data sources, and certainly I think a lot of people probably have some ideas. We could do something. So
And you can propose an idea and you do not have to be the person who leads it. So don't feel like if you propose something, you're gonna have to be the one to move it forward.
yeah, exactly. Like, and maybe some of the practitioners, if like, what do you want to know about in your community? Does this answer things? What could you use it for? And maybe just think about those questions and we could take it from there, you know, or see what might come from that.
Absolutely. I will include that in my follow-up meeting. The little question to send back to me.
Yeah, and maybe put a date on it or whatever, just in time for the meeting so that we can spend the time at the meeting working on it or talking about it, whatever.
Absolutely. Wonderful. Well, if there's nothing else, we can end there today. But thank you all for taking the time to join, and I will see you next month on the 20th.
Thanks, everyone.
Great, thank you.
Thank you all.
Bye.